Third of the country's COVID-19 survivors may be at risk of reinfection, and at least 50% of South Africans may have already contracted the coronavirus. Now, that's based on Discovery Health data. But to discuss this, Alex Welte from the South African Centre for Epidemiological Modelling and Analysis joins us now from Cape Town. Prof, thank you so much for your time and good morning to you. I suppose I want to start here. You of the notion that South Africa is likely to have a much more weaker third wave. What informs this?
Well, I mean, the fact that, so many people have already been infected gives us that hope. So it's really not a very concrete prediction. But I think the backbone of the cautious hope that we have, that the third wave will not be anything like the first and the second, is that we have had so many people infected already, and this does confer some immunity. So that particular point that you were just addressing there, this statement about the 1/3 may not have immunity, so that's a complicated question. I don't think we can put a number to that. But I think the valid point there is the real concern that the evolution of the virus and the emerging of these new variants, which emerge locally to some extent and which get imported to some extent from other places, these new variants do not necessarily respond as well, as submissively, if you like, to the antibodies we've brewed up from previous infection by different strains. And so whether the average number is that our risk is only reduced by 2/3 instead of fully, or how that's averaged, that's not important exactly what that number is. But for sure, it reduces the immunity that we have at both the individual and the collective level.
Right.
But there's another factor, which is that simply the new variants may be just that much more transmissible, for example, which is why they've been selected. So if a new variant comes along and it doesn't do a good job of propagating, then it won't spread and it won't survive. The fact that some of these new variants are spreading successfully is very strong proof. Aside from any direct experiment on individuals, it's at the collective level, it's very strong proof that they are good at transmitting themselves. And so that raises the bar for how many of us need to have some kind of immunity before we can shut down that transmission network. So look, there's a very sobering reality there. And the third wave has kind of begun at some level already.
Right. It's
not yet a terribly huge thing, but it's there. And I think a key fact that we see in all these modeling projections is the incredible uncertainty that we have about how that's going to go. And I think we shouldn't view that as, oh, the data is inconclusive,
right,
in the sense that and we don't know what we're doing. And it gives them credence to a lot of kind of crazy theories about, oh, this is all bogus science. These people don't know what they're talking about. The tests don't work. This doesn't work. There's no, it's not that.
Right.
It's that a mathematical model cannot predict the choices that we're going to make.
All right. Prof, if I can just jump in there because of time. We're running out of time, unfortunately. I mean, with that being said, then what sort of government response is there needed at this stage?
Well, I think a very cautious dabbling in some restrictions, like restrictions on nightlife and sporting events, places where big crowds get together. I think those things should be restricted. Obviously, nobody wants any of the more vigorous restrictions that really make it hard for people to earn a living. That and all due, haste and effort to make vaccines available to people. That, I think, is the one thing that is very concrete and that doesn't really impose limitations on anyone. Get those vaccines, get them distributed and make them available. That's a huge priority at this point.
Yeah, because it seems that behavior is still a big cause in terms of just some of the reports we're seeing and the data we're seeing in the spread of COVID-19. South Africans and I suppose around the world seems to be experiencing, pandemic fatigue at this point.
Absolutely. It's understandable, right? I mean, this whole thing of don't touch your face. I mean, how many months can you go with not touching your face? It's sort of a joke. I mean, nobody can live like that. So, I think we have to just look at the basics, do the most effective things, focus on those, and not sort of hog-tie ourselves with the hundreds and thousands of little micro-regulations. Do the things that have big impact and do them properly. Wear a mask, stay indoors, not stay indoors, I mean, stay amongst our family, don't mingle unnecessarily with people we don't live with. Those are still the good, solid rules by which to live at this point, as far as we can.
All right, we'll leave it there. Thank you so much. Professor Alex Welte from the SA Centre for Epidemiological Modelling and Analysis.